Can AFib cause a stroke? Unfortunately, the answer to that question is absolutely yes. Now, that turns out to be the most dangerous thing about atrial fibrillation. Remember, atrial fibrillation causes symptoms by these abnormal cells that we call AFib that form in the walls of your heart in a different spot than your normal cells that you're born with, and they sleep and do nothing or randomly wake up, generate their own electrical signals, take over control of your heart away from your normal source that's telling your heart to beat at a normal speed. And then when they're fully in control, they'll tell your heart to speed up and beat at whatever speed they want, which is something usually way too fast. And that's what causes the symptoms of atrial fibrillation. And remember, the symptoms of rapid heart rates in atrial fibrillation are not directly life-threatening. Your heart will never go at a life-threatening speed the way some dangerous rhythms can make your heart go at. And AFib is not one of the directly dangerous life-threatening heart rhythms. But unfortunately, AFib also has one other problem that is potentially dangerous and life-threatening, and that is this risk of clots and strokes. Now, the standard way of having a stroke is that you just live long enough and get old enough to form cholesterol blockages directly in your brain vessels that cut off blood supply to your brain and cause a stroke. And that actually has nothing to do with atrial fibrillation. That's you getting older, having a bad diet, high cholesterol diet, smoking, diabetes, high blood pressure, family history, blah, blah, blah. Just like you could live long enough to develop blocked heart arteries, cholesterol blockages in your heart arteries that cuts off blood supply to your heart and causes chest pain, damage, and heart attacks. And that has nothing to do with atrial fibrillation. That's you getting older, having a bad diet, high cholesterol, smoking, diabetes, blah, 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 all those things. Atrial fibrillation can cause a stroke a secondary way. And that is every time the AFib cells wake up and take over control of your heart to make it go faster, whether it's fast enough for you to feel or it's not that fast and you don't even feel it. It doesn't matter. Every time the AFib cells wake up, whether they cause symptoms or not, there is somewhere on average between a 3 to 5% chance that a tiny blood clot, not a cholesterol blockage, but a blood clot might form inside your heart during that episode. And that's very dangerous. Now, some people will say, well, 3 to 5%, that's not very high. I mean, that kind of means I have a 95, 97% chance that nothing bad will happen. And that's true. You have more of a chance that it won't happen, that a blood clot won't form inside your heart than it will. But 3 to 5% is not zero. And by the way, it's average 3 to 5%. The range is actually, depending on your age and comorbid medical conditions, the older you are and the more other medical problems you have, the higher risk you have having clots and strokes with atrial fibrillation. There's actually a scoring system called the CHA₂DS₂-VASc scoring system, where we give people a point score, and every point correlates to about a 1 to 1.5% increased risk of clots and strokes. So based on the scoring system, there are people who are young enough with not very many medical problems where their risk of clots and strokes might be 0 to 1% or 1 to 2%. Then it goes as high as almost 8 to 10% risk, but the average is probably about 4 or 5% risk, and that's not zero. And if your risk is anything over 2%, standard of practice guidelines recommends that we try to mitigate or reduce your risk of clots and strokes by using a special blood thinner. And so even though 3 to 5% risk is not very high, it is not zero, and it could happen. And if you did form a clot inside your heart, you wouldn't feel that you have a clot inside your heart, but once it's there, it tends to break loose, float out of your heart, float up to your brain, cut off blood supply to your brain, and cause a stroke. And nobody wants to have a stroke. Some people feel like having a stroke is worse than death because you can be very severely debilitated. Now, the way we treat that is we usually put people on a specific or certain specific blood thinners, not just any blood thinner. We're not talking about like aspirin, or sometimes people are on medications like Plavix, which are to prevent blood clots in heart stents. No, that's not gonna work here. There's many different clotting factors in the body, and the ones that can form clots in your heart from atrial fibrillation are very specific ones. So you need a very specific blood thinner. But if you're put on a very specific blood thinner to prevent the risk of clots and strokes, the blood thinner can reduce your risk, not necessarily all the way to zero, but close. It can reduce your risk to less than 1%, which is, we feel, close enough that you likely aren't going to have a clot and a stroke from atrial fibrillation. Now, let's say we put you on a blood thinner, and that's the most important thing, because every time we treat somebody for AFib, we always have to assess their risk for clots and strokes, because that's the most dangerous thing that can happen to them. and then make sure that they're protected, usually with a blood thinner. And once we do that, everything else we do is just to treat their symptoms, which everybody's different in terms of how much symptoms they have. But once we protect you from clots and strokes, that's the most important thing. And if we put you on a specific blood thinner and it reduces your risk to less than 1%, then great. But remember, treatment to protect you against clots and strokes is different from treating your symptoms. Both have to be treated. If we put you on a blood thinner to reduce your risk to less than 1% of a clot and stroke, where we feel like you're pretty much protected and you're not going to have a clot and stroke, that doesn't mean you're not going in and out of AFib having symptoms. If you're going in and out of AFib and we put you on a medicine to slow that down so that you barely feel it, and you're not even really feeling much symptoms, and you feel great, doesn't mean that you're not going in and out of AFib and potentially can have a risk for clots and strokes. So whether your risk for clots and strokes is 2%, 5%, 8%, depending on your age and circumstances, we would recommend anything over 2% that we put you on a special blood thinner to reduce your risk to less than 1%. And once again, that doesn't mean you can't have a stroke if you're on a blood thinner. You can still have a stroke the standard way by forming cholesterol blockages directly in your brain vessels directly, and that has nothing to do, once again, with AFib. But it should protect you drastically or significantly from having a clot and stroke from atrial fibrillation, so that we can then turn our attention to treating whatever symptoms you have, which has to do with your stage of AFib, how much you're going into it, and what speed it is, and how much of that is affecting you.